Okay, greetings everyone. Welcome to session 1 of the Washington Healthcare Facilities Initiative webinar series. My name is Joanne McGriff, and I'm the Associate Director of the Center for Global Safe Water, Sanitation, and Hygiene at Emory University, as well as Assistant Professor in Global Health at the Rollins School of Public Health. Today I'm joined by members of our learning team, Ms. Lindsay Denny and April Klein, and we also have the Director of the Center for Global Safe WASH, Dr. Christine Moe, and Habib Yakubu, our in-country team lead for Washington Healthcare Facilities. Just before we start, I'd like to acknowledge the GE Foundation as one of the major sponsors for this webinar series, as well as the Emory University Center for Global Safe WASH for developing and facilitating the platform. I also want to thank all of you who are joining us from so many different locations and organizations. We were really happy to see over 190 registrants for this webinar today. And already within the first few minutes, we're already almost at 40 participants who are online. We want to thank you for sending out our flyer to your contacts and networks, and we encourage you to continue doing so. We believe the series will be as strong as the participants who attend, and so we're really excited about your presence today and all of the sharing that's going on. So just to provide a brief introduction, I want to go over the mission of our initiative here. It's basically threefold. We first want to connect partners with each other and also to necessary evidence and resources that they need to develop and implement WASH and healthcare facility programs. Second, we want to provide a platform for the community of practice to share experiences as well as ideas and best practices. And third, we want to encourage groups to take specific action to move WASH and healthcare facilities from discussion to the implementation of sustainable interventions. Just a word about the structure of the platform as well as logistics. Each month, we will highlight WASH in healthcare facilities subject matter experts in a 20-minute presentation, followed by 5 to 10 minutes of expert commentary. And then we'll move to 30 minutes of interactive facilitated discussion. For today, given that we will have a bit of a longer introductory portion, we will not have a commentary, but we will move directly from the presentation over to the discussion. We also want you to keep in mind that we will be launching our webinar website, winhcfaction.org, very soon. The website will house the webinar recording, slides, summaries, and action documents after each session. It will also have the pre-recorded WASH and healthcare facility overview presentation that we encourage all of you to review before joining the series, as it gives a comprehensive overview of what we call the WASH and healthcare facility basics. And then lastly, please feel free to email inquiries, feedback, and recommendations to winhcfaction@emory.edu. Now I'm going to pass it over to my colleague Lindsay Denny to continue this introductory portion of the webinar.
Thank you, Joanne. And as she mentioned, I'm Lindsay Denny, part of the WASH and Healthcare Facilities Learning Team. Hopefully you've had an opportunity to watch the pre-recorded webinar. If not, I would recommend going back and having a listen after this. For today, I wanted to touch on why exactly we're here and some of the principles behind this webinar series. So first, why are we pushing for further action on WASH and healthcare facilities? The Sustainable Development Goals, or SDGs, are a list of 17 global goals developed by the United Nations as a part of the 2030 Agenda for Sustainable Development. WASH and healthcare facilities is not explicitly listed, but it is required to achieve Goals 6 and Goal 3. Goal 6, Clean Water and Sanitation, aims to achieve access to safe drinking water, sanitation, and hygiene for all. It's this focus on equitable access that requires the inclusion of institutions, such as healthcare facilities. Goal 3, Good Health and Well-Being, centers around universal health coverage, including access to quality essential health services. Their targets including decreasing the number of deaths and illnesses attributed to WASH, reducing the maternal mortality rate, and ending preventable deaths of newborns. In March of this year, the UN Secretary General, Antonio Guterres, made a call to action on WASH and healthcare facilities during an event marking the launch of the Water Action Decade. He said, "We must work to prevent the spread of disease. Improved water, sanitation, and hygiene in healthcare facilities is critical to this effort. We are here to support the achievement of the SDGs through WASH and healthcare facilities, and the call to action further drives these efforts." There are several guiding principles behind this webinar series. It's based on these tenets that topics and speakers are selected, so we wanted to go over them today. First, we believe that WASH is a fundamental prerequisite for a quality healthcare facility. Secondly, there cannot be effective infection prevention and control without adequate WASH in healthcare facilities. Third, sustainability should be built into every WASH in healthcare facilities project from the very beginning, no matter the project size. And fourth, WASH in healthcare facilities is not just about addressing issues at individual facilities. Multiple systems, sectors, and stakeholders must work together to see sustainable improvements. Each month during the webinar introduction, we will provide you with any published articles, upcoming events, or interesting case studies we come across. WHO and UNICEF put out a more comprehensive newsletter every quarter. If you're not already subscribed, you can go to their website, washinhcf.org, and receive the newsletter every quarter. For this month's updates, if you haven't read the article from Ryan Kronk and Jamie Bartram of UNC on environmental conditions in healthcare facilities, I highly recommend it. It expands on the 2015 status report and includes data from 78 countries and more than 120,000 facilities. It's the most comprehensive data on the global status of WASH in healthcare facilities currently available. Also this year, UNICEF released a report for their Every Child Alive campaign. The campaign focuses on the 4 Ps: place, people, products, and power. Place focuses on guaranteeing clean, functional healthcare facilities equipped with water, soap, and electricity within the reach of every mother and baby. And finally, Emory recently published a report from the site event, Moving from Assessment to Action in WASH in Healthcare Facilities. What are the solutions? This was held at last year's UNC Water and Health Conference. It's this event's speakers and presenters that are the inspiration behind this webinar series, so their report may be of interest to you. It can be found at washinhcf.org. Over to you, April.
Thank you, Lindsay and Joanne. Before we get started, I want to provide a quick explanation of the webinar features that we will be using for anyone who might be new to Zoom. It's very easy and straightforward. On the bottom of your screen, you should see a word bubble where you can click to use the chat box. The drop-down menu there will allow you to choose if you want to send messages to only the hosts and panelists or to all of the attendees here, as well as the hosts and panelists. Feel free to use this chat box to introduce yourself to everyone, where you work, what you do. You're also free to comment throughout the presentation. We will be having a discussion using the chat box following Alison's presentation, so please hold your questions until that time. You should also see a white hand down at the bottom of your screen, which is the raise hand feature. If you click this, it should turn green and indicate to the host and the panelists that you would like to comment or question verbally. The hosts have the ability to turn your audio on and off to speak over the webinar. So please only use this feature when requested by the host or presenter to do so. Additionally, if your question has been answered or you no longer wish to comment, please lower your hand by clicking it again so that we do not call on you to speak. Please only attempt to use this feature if you have a working microphone on your device. And finally, there's a polling feature that I'm not going to go into in detail today because I don't believe we'll be using it. But in case we do, if it pops up green, there may be a brief set of questions that you can respond to that will remain active for your responses as long as the host decides to do so. So with that, I would like to welcome you all once again and repeat the sentiments of Joanne by thanking you for your presence. We're very excited to see so many people from so many different countries and organizations take part in such an important issue. Session 1 today is going to be focused on strengthening the health system for sustainable WASH improvements, adopting a health systems approach at all levels of WASH and healthcare facilities programs. Our expert presenter today is Alison Macintyre from WaterAid, and she supports WaterAid-Australia's work on the intersection of WASH with human health. She supports health-related research, programming, and policy work in Southeast Asia and Pacific regions, as well as supporting WaterAid's global policy and advocacy efforts. So with that, Alison, thank you for speaking with us today, and I will turn the floor over to you.
Great, thank you all for the opportunity to speak today, and good morning, good afternoon, and good evening to those joining from around the world. As introduced, I we'll be talking today about how to improve washing healthcare facilities in a sustainable way by working through with health systems. Just an overview, of course, I could talk about health system strengthening, different ways to work with the health system frameworks for several hours is not the aim of what I want to get through today, but just to give, I guess, a framework and a way of thinking for addressing washing healthcare facilities related work through taking a health system strengthening approach. Talk about why this is important, what it involves, lessons that WaterAid has learned from the work that we've done in adopting such approaches, some of the areas that we still need for action, and then a way forward. So why a health system strengthening approach? If you've had the opportunity to listen to the webinar that Emery has recorded as a prelude to this webinar series, it would have talked about some of the health benefits that we expect to see from improving washing healthcare facilities, and several of those are listed here on the screen. And while WASH really underpins a lot of these health issues and is a really critical contribution to making change and seeing the health outcomes we want, it is only one of several interventions, many of which are specifically health and clinically related. And so this is one of the key reasons why we need to work with and alongside those interventions through health systems to see the change we aim to see. Okay, so on the left of your screen, you will see what we often come across in healthcare facilities with limited wash, and that's a sink or a hand washing station, as this one is, that's not functioning, not really appropriate for the setting, and hasn't been constructed in a way that will facilitate good hand hygiene. And then the photo that we see on the right is kind of what we would like in an ideal setting. So soap that's available, water that's running, hand washing practice occurring, IEC materials available. And so what lies in between the picture on the left and the picture in the right? And often when I give a presentation such as these, I'd ask the audience to come up with what some of those reasons might be. But with the technology that we're using today and the time that we have, I've done a bit of the pre-thinking for us all. And I guess there are several different determinants or causes that could be leading to these differences. And this could include having adequate budget available to address repairs and operation and maintenance, that supply chains are available for things like soap and some of the materials you might need for the construction and repairs, that there are accountability mechanisms and guidelines and standards that set out clearly what's required, and that health facilities and managers are held accountable to that. So there are several different reasons that might lead to the picture we see on the left from reaching the picture that we see on the right. And in order to address this, we really need to take a systems level approach. Now I'm going to share one of my favourite conceptual framework that I've borrowed today from the Soapbox Collaborative, and that's one they put together as part of their work on clean deliveries. And so often when we think about washing healthcare facilities, we really focus on, I guess, two key aspects that we immediately see, and that's the visible cleanliness, and in this case, in this framework is a maternity ward, but also the absence or the lack of functioning infrastructure and availability of equipment. But really, when we look at this conceptual framework, there are so many other elements that we need to consider in order to reach what we want to achieve here over on the right-hand side of the screen. And we can't ignore addressing these elements if we really want to see sustained improvements in wash in healthcare facilities. Okay, so what constitutes a health system? What I've shared here is the WHO Health Systems Framework that was first developed and shared in 2007. And while there are many frameworks that I could have drawn on, I think this one is just a really useful one for thinking about the different elements that feed into a health system and what that might mean for addressing wash-in healthcare facilities. Of course, there are several arguments on potentially some additional building blocks, including community empowerment. But for at least our purposes today, it's good to think that in this framework here often links to a lot of the things we talk about in wash-in healthcare facilities. So we have our system building blocks or inputs in some way to the left-hand side of the screen. We often talk about quality and safety. we want access and coverage, and we want to see the health changes that are mentioned in the goals and outcomes. So what does this really look like in a WASH in healthcare facilities way? And recently, WHO and UNICEF have been developing a response to the UN Secretary General's call to action on WASH in healthcare facilities. And what I'm displaying here is, I guess, an almost final version of what they're defining as a national package for WASH in healthcare facilities and a roadmap for change. And this has been developed somewhat thinking through those health system building blocks into a package of activities that addresses those building blocks, specifically for WASH in healthcare facilities. And as you can see, I guess underpinning all of this is strong leadership and governance, which is core to health systems, and many of the other building blocks that we talked about. So looking at health information systems and tracking WASH in healthcare facilities through health management information systems, looking at things to empower and train, so adequate human resources. Of course, at the service delivery level, having appropriate infrastructure, and then at the policy level, things like standards. And so this is the national package that they've defined in order to reach universal access to WASH in healthcare facilities and, of course, supporting quality care for all. Now, I just wanted to take that ultimate goal of quality care for all. Now, in my previous slide, I shared what a national package of activities is for WASH in healthcare facilities. But when working through the health system, it's a slightly different focus and way of working that we might directly think for WASH. So we need to take that national package of services and then fit it into with the systems and the priorities that the health sector operates in. And to provide an example of this, I'm going to share WHO's standards for improving the quality of maternal and newborn care in healthcare facilities. And as you can see, taking that, taking that package of activities that we talked about in the previous slide and thinking through how they can be used to support a quality of care process that is addressing maternal and newborn care. And so obviously here we have the standard number 8, which looks at the essential physical resources that are available, and this is really critical to WASH, but it's also bringing in the other elements of the package, for example, practices around infection prevention and control, which are featured here in number 1, thinking about the health workforce and patient satisfaction, community engagement, which really focus in experience of care around 4, 5, 6 here. And making sure that the right workforce is in place to address clinical care, but also WASH-related issues, for example, cleaning and operation and maintenance. So it's really about thinking about the system building blocks, having a package of activities that can be built into that health system that relate to WASH, and then translating those into a health approach to improve quality of care. And so how do we do this? And when we think what a health system strengthening approach is, it is really, rather than having a standalone program, it is thinking about how an intervention or a program of work can really be designed to influence across all the elements of a health system, so it operates through those existing health system functions and works to strengthen it. So if a healthcare facility exists, it does indicate that there's a health system around that. And so we really need to acquaint ourselves with that health system and work through it. And what the evidence has shown through other health systems research is that when we do take a health system strengthening approach, it drives broader progress across the health system and it supports the achievement of universal health coverage. So what does a health system strengthening approach involve? Now, I just wanted you to think about that national package of activities. So how, if we were starting a WASH in healthcare facility focused program, do we take this national package of activities and start about implementing it? Often, in approaching a WASH in healthcare facilities program, the first thing we do is a needs assessment, which is critical. So we want to know what the WASH conditions are, where the gaps are, and what we might need to do to address it. But prior to that, what we've learnt is really critical in order to operate through the health system is to really understand the context and the health system with which this healthcare facility or collection of healthcare facilities is operating in. And there's an approach that WaterAid has taken to really understand this. And what I want to emphasise here is that while this approach is really critical, particularly for driving national level change, nevertheless, it is also an important approach, maybe at a smaller scale, at a district level or in a cluster of healthcare facilities. So it's critical at both a national level and a subnational level, depending on which level you're working at. So health system scoping, and what's that? That's really understanding the health service delivery model overall that exists within a country. What are some of the policy priorities, the health priorities, the key actors and their roles, and also a political economy analysis. So trying to understand who holds the power, how change happens, who we need to work with to reach the program outcomes that we want. And then we take that a step further and specifically look at WASH in healthcare facilities. So while we might see gaps in WASH at the facility level, there still might be policies, monitoring mechanisms that exist. So it's doing an assessment to see, are there any policies, standards or guidelines that relate to WASH or infection prevention and control? Who within the Ministry of Health or potentially other ministries are responsible for ensuring WASH in a healthcare facility? Are there any other actors that are working on WASH in healthcare facilities? What are the opportunities and bottlenecks to creating change? And so really understanding that in the existing health system and how that operates. And then this doesn't have to be chronological, but can happen simultaneously, whether this is at a subnational or a national level. It's establishing coordination mechanisms that might bring together other actors who are involved in WASH in healthcare facilities, form relationships with those responsible in the Ministry of Health across all levels, and building a stakeholder group to really make decisions and work through the health system in order to make change. And then when we get to the needs assessment level, it's important to think broadly, so not just focus on the WASH infrastructure and perhaps the JMP core and extended indicators, but also design the needs assessment in a way that really unpacks some of these determinants. So we know what some of the system's gaps are, so we know what some of the individual determinants might be that are preventing adequate WASH services and practices at the facility level. And then we use this information based on the health system, based on the determinants, to design action. And now I'm going to talk through some of WaterAid's experience. So earlier this year in May, WaterAid released a report that's shown here on the right-hand side of the screen called Transforming Health Systems, the Vital Role of Water Sanitation and Hygiene. And this report outlines our thinking around WASH in healthcare facilities and health system strengthening, why it's important, but also showcases examples from programs across the world on how they've taken a health system strengthening approach to improve WASH in healthcare facilities. And while I won't be able to share all the examples in this webinar today, I will share a snapshot of a few of those. So one of the lessons that we've learned is that we need to build strong relationships and coordination processes across sectors. One example we highlight is the work that WaterAid's done in Cambodia. And WaterAid started working in WASH in healthcare facilities about 4 years ago in Cambodia. And from the outset, the program did an assessment of who the key actors were working in WASH in healthcare facilities, and WHO had an interest, UNICEF had an interest, and Emory also had an interest. And in engaging with the Ministry of Health, they developed an informal working group to bring the strengths of each organisation and the relationships of those to really drive change that's resulted in the improvement of a comprehensive set of health policy documents that now include WASH, and this includes having targets in the National Health Strategic Plan. It includes guidelines for WASH in healthcare facilities, WASH built into the minimum package of activities for health centres, and so on. What I wanted to highlight that while this relationship was critical for driving change at the national level and really leveraging the strengths, relationships and experience of the organisations within that coordination group, it's also translated to be critical on the ground, where each one of those organisations have been operating to drive change at the facility level, but there's now synergy in the approaches that are being taken. They're working together to make sure that it's built into existing health system functions and aligning with the Ministry of Health Quality Improvement Program. The second lesson I wanted to share is from work that WaterAid's done in Myanmar. And addressing WASH in healthcare facilities has been a priority of the WaterAid's program in Myanmar for the last few years. And in undertaking and scoping the way in which WaterAid could support the Ministry of Health and Sport to improve WASH in healthcare facilities was really to understand their health priorities. And one of the key health priorities is to improve the level of institutional delivery and the quality of care around childbirth in Myanmar. And so in doing the needs assessment and working with a multi-sector stakeholder group similar to that in Cambodia with WHO, UNICEF and the Ministry of Health, a needs assessment was designed that really focused on measuring the extent to which WASH was supporting improving quality of care for maternal and newborn health using WHO standards for maternal and newborn care. And so in doing that, the gaps in terms of WASH being able to support quality of care were identified, and some of the determinants that would need to be addressed to see the change that was required to support quality of care. So in framing it specifically around that health issue allowed to identify where the specific points were across the different elements of the health system that could be strengthened to support that quality of care. The third effort is really around building WASH indicators into health management information systems. And again, in partnership, WaterAid worked with development partners, WHO, UNICEF, civil society organisations at the national level to work to build basic WASH indicators into the health management information system so that the national government could target programs and efforts where they were most required, and also to work with these stakeholders in order to address these gaps and work out ways in which they could make change at the facility level. The fourth one is one that we often forget from a health system strengthening perspective and is definitely not clearly represented in the WHO framework for health systems, but one is that we shouldn't forget, and that's really the importance of the community and users of a healthcare facility to hold duty bearers to account. And in Malawi, WaterAid has worked with civil society partners and the community to help strengthen the understanding of the community about their WASH rights at the facility level, to support engagement at the national level with those who work in the Ministry of Health and duty bearers for those WASH conditions in healthcare facilities, and facilitate a dialogue. And that dialogue, alongside some of the work that WaterAid's supporting strengthening WASH in healthcare facilities through national policy, has really driven change, both at the national level in terms of the prioritisation at WASH in healthcare facilities, but also for the communities that they worked with. So what are the challenges? Of course, we showcase some of the lessons that we've learned and success stories that we've had, but there's also a lot that we still need to consider, build technical knowledge around and understand to have a comprehensive health systems approach to addressing WASH in healthcare facilities. One of the key areas is leadership and political will. And though in the first two examples particularly I talked through how coordination and building within health priorities help drive leadership and political will, there's still a long way to go, and it's definitely not a once-off problem solved. It requires persistence and continually driving and sustaining that political will at all levels of the health system. Often WASH is considered as a WASH issue and not really a health issue, so there needs to be continual efforts and advocacy to make sure that it's adequately prioritised. Governance and regulation. I think in most countries that we work in, we recognise that there are both private sector providers as well as public sector providers of healthcare, and these could be through privately run clinics, also through faith-based organisations and other non-government providers. And often there's a lack of coordination among private sector providers or regulation and accreditation mechanisms that we can help strengthen to ensure that public and private sector providers are ensuring good WASH at all facilities. Financing is one of the biggest challenges that we face. So firstly, in understanding costing and how much WASH in healthcare facilities costs, but also in using existing health budgets for increased and improved use of domestic financing to address WASH in healthcare facilities. Often WASH-related elements don't feature In budgets, whether that be for small operation maintenance and supply side, but also for large capital investments and upgrades that might be required. Also, from a donor financing perspective, there's often an over-reliance on WASH earmarked funding to address this issue, and there's a lot more work to be done to raise the amount of donor financing, but also make sure it's the right type of financing that supports health system strengthening efforts for WASH improvements. Monitoring and targets, we now have the agreed JMP indicators, but there's still a lot more work to build those into routine monitoring mechanisms and make sure that that data is used for decision making and targeting of efforts. Research and learning, and often working within the health system or within clinical care, there's a pressure to take strong epidemiological type designs to the research that we do. But I think it's really important that we start using health systems type research to focus on taking what we learn from our interventions and things we do at the facility level and take those to scale. So to really understand what works within the health system and take that to scale and not rely too much on spending our attention on evidence to looking at specific health outcomes. And also finally is technical solutions, so making sure the right affordable technical designs are available and are suitable to the context, and to make sure that no new healthcare facility should be built without adequate WASH. One of the things in assessing policies is to look at building designs that exist at the national level. And often what we might consider basic WASH provision doesn't exist in those building design guidelines. So it's important to think through how we might strengthen those as well, so that when new facilities are built, they are built with adequate WASH infrastructure. So a way forward, of course, there's a lot that we still need to do, and there's a lot that we've learnt through addressing WASH in healthcare facilities, taking a health systems approach. And I'm just going to share, I guess, one way in which, from what I've learned from the experience that we've done, in a way that we can approach WASH in healthcare facilities through health systems. Of course, earlier in the webinar, I shared what might need to come upstream or alongside a needs assessment. So understanding the health system that your work is operating in, understanding what already exists through that systems for healthcare facilities, what might need to be strengthened, and who are the right people to be working in. Coordinate and work with actors, including the Ministry of Health and through governments. It's really important to have the Ministry of Health's leadership in all WASH in healthcare facilities efforts, but also to align work with other actors that might be working on quality of care, including WASH and infection prevention and control. And then making sure that needs assessment really addresses the determinants before planning action. So what do we know works from this? And as I mentioned before, it's critical that government or ministries of health are the lead, while responsibilities might sit across other WASH ministries or ministries for environment. In taking a health systems approach, it's really critical that there's leadership from the Ministry of Health. This also needs to be reflected at right down to the patient level, so at the service delivery level, to engage communities, to hold duty bearers to account, and really make sure that the services provided are usable, accessible and desirable for those. So really focusing on the patient-centeredness or the people-centeredness of the healthcare that's being provided and how WASH supports that. What you really need is to drive new collaboration. They'll be working with actors, people within the ministry that you haven't before. It will also be facilitating the interaction between different actors across different elements of government or different organisations that have never worked together in order to address WASH in healthcare facilities. One of the critical elements is, I talked a lot about advocacy and driving leadership, but that has to be met with technical support. So that even within, if policies do prioritise WASH in healthcare facilities, we'll need to be drawing on a diverse set of stakeholders from WASH, such as engineers, but also more clinical sides of infection prevention and control, and bring those technical support efforts together to see quality programs unfold. One that we've found really essential is a trade-off, so which is speed versus support and strengthening the systems. While we might identify gaps in WASH and feel that we have solutions to address those immediately through infrastructure upgrades or a training, thinking through how we work at the pace of policy change, we work at the rate in which a health system will change, so to slow down the way in which we work to make sure that it's strengthening the health system more broadly rather than just an immediate one-off project. In order to support this, it's really critical to have flexible funding. So maybe at an outset of the project, we might not know what the interventions would look like. They might not be actually taps and toilets. There might be a whole lot of determinants that need addressing that might not actually translate to a larger number of taps and toilets within a facility, but we might be looking to measure other elements of change. And so having flexible funding mechanisms to be able to address different needs across the health system building blocks is critical. And then really what underpins this is it allows you to develop and expand local initiatives. So for example, if I take the Cambodia example, there's a really strong initiative from the government to improve quality of care. And so by taking this health systems approach, WaterAid and partners within Cambodia have been able to design the interventions at facility level and continue to contextualise and adapt them to make sure they align and fit with the existing quality improvement package that the Ministry of Health is rolling out nationally. And that then means there's that opportunity to take it to scale once it's tried, tested, and contextualised. What some of the challenges are, of course, we need to maintain and strengthen coordination. We really need to make sure we take the time and effort to distill the knowledge and the learning from our projects and share that. There's still more work to be done to cost and really understand what adequate resources are required, particularly domestic resources to address this issue. There's a lot more we can do around private sector engagement, be that through addressing WASH in healthcare facilities, but also private sector providers and the regulation and accountability of those providers of care. While an initial stakeholder group might contain the critical actors, it's an ongoing process to make sure that WASH in healthcare facilities is featured across a whole set of health issues. So obviously maternal newborn care is one of the critical ones, but there's also ongoing advocacy to bring in actors focused on issues such as antimicrobial resistance, universal health coverage, quality of care. There are many, many, many different stakeholders that are operating within the health system, and we need to continue to advocate, influence and engage them on this issue. And then for those of us working strongly on WASH, particularly on looking at district-wide approaches or sector strengthening for WASH, there's further thinking required about how we link and align health system strengthening approaches with WASH sector strengthening approaches, particularly as we move more in WASH to move beyond the community level to looking at institutions such as healthcare facilities. Wonderful. Well, that was a very quick overview of WASH in healthcare facilities and a health system strengthening approach. But I'd just like to thank you all again for joining and listening. And I hope we've got some good questions and discussion following on from this presentation. Thank you.
Great. Thank you, Alison. This has been a really informative presentation, and we agree in terms of stressing the critical importance of system context, determinants, and just ways to even assess the system issue. So we really thank you for this. And so now I would like to open up the floor for a discussion, but I want to provide a bit of guidance before we get started. As we talked about at the beginning of the webinar, there are two ways to ask questions or to make comments. You can type your question into the chat box, or you can use the raise your hand function that's on the Zoom menu. So just be aware that if you raise your hand, we will call you by name, and we from here will enable your audio to speak. Please be mindful that only we can mute or unmute you, so you don't need to look for your mute button. For the people who type in their questions, we will try to alternate between live audio questions and the written ones. If we do not call on you to speak, or if we somehow are not able to get to your written question, please be aware that we will be answering as many chat box questions as possible in a summary document that will be posted after the webinar. So please be sure to put questions in the chat box before exiting the webinar, and we'll do our best to address them with Alison's assistance. Lastly, although we are here to glean as much as possible from Alison, we want to encourage webinar participants who have relevant experiences in response to a question to feel free to type it into the chat box or raise your hand. So without further ado, I just want to throw out the first question to Alison. So for those who don't have the reach into the national government and the Ministry of Health, how can they start influencing the health system? And which aspects of the health system might also be influencing their work? And can you provide any examples of this?
Great, thanks, Joanne, for that question. And I do think it is really critical because obviously Washington Healthcare Facility Program operate at all different levels of the health system. And while some actors, particularly such as WHO and UNICEF, might work strongly at the national level, there are also several people working on Washington Healthcare Facilities that work at the sub-national level. And I guess there are two key points I would like to raise here. And one is, I guess, influencing the health system, and one is working through its existing function. So while you might not do such a comprehensive analysis as you might do at a national level, it is really critical to refer to some national level documents to understand, if we think about what elements of the health system might influence work at that subnational level, are there standards and guidelines that you should be aligning your work and then perhaps extending upon if they're not meeting the needs of the healthcare facility. So that's one way in which I guess the health system might influence work, and a way which you could feed back to local level government or the health facility management around ways in which perhaps those standards might need to be adjusted or changed to meet the particular WASH needs of a healthcare facility. One of the ways at a subnational level is really around monitoring, I think, is one key way in which you can look at the existing monitoring mechanisms and how data is captured and how it's used to inform decision-making and resource allocation at the subnational level, where the WASH is represented, how it could be included, look at ways in which to build it in and test that, and then use that information to address some of those WASH needs through the government and those responsible at the subnational level. While that's all easy to say, I'm not saying it's easy to execute, but they're just two, I guess, examples of ways in which the health system can influence the work and how that can be influenced and strengthened back. And I don't know, I suppose it's in terms of examples, I could provide some WaterAid examples, but I do wonder if there's anyone from the floor, if they're willing to speak, that could perhaps share specifically at a subnational level how they've worked with and through the health system and or influenced some of the processes at that level.
Yes, please. If you do have a comment or would like to address Alison's question, please raise your hand or type into the chat box.
Okay, perhaps while we wait, I wonder if I should just share a small example from some of the work for that WaterAid's done in Timor-Leste, and just why critically at the subnational level it's important to understand some of the roles, responsibilities around WASH in healthcare facilities, and there's been a prioritisation from the government around having hygienic status, so moving beyond open defecation free areas to looking at broader hygiene that includes WASH and hygiene at healthcare facilities and schools. And so some of the work that WaterAid's done is really looking at rural healthcare facilities and understanding roles and responsibilities around that, and what might differ from other countries where the Ministry of Health has sole responsibility over washing healthcare facilities even, or what happens at a healthcare facility in a rural setting. It's quite a different set of roles and responsibilities in the Timor setting, where those that are responsible for community rural WASH also have ownership and responsibility over the water supply at rural healthcare centres. And so in order to address some of the gaps in specifically water provision at healthcare facilities was around understanding those roles and responsibilities, supporting coordination between those at the local and district government level to talk together and work out a joint plan of action through Ministry of Health as well to address some of the WASH gaps in healthcare facilities. So I suppose that's one example of why it's critical to really understand those roles and responsibilities, and then way in which you can strengthen coordination and action at that subnational government level to address those gaps.
Thank you, Alison. We have a question from the text box that we are going to go to, where it says, in your experience in Uganda with influencing new wash and healthcare facility standards, how did you catalyze this? Was it WaterAid's field experience? Was it the higher level core recommended indicators? And this is from John Brogan.
Well, this is a good question. I wasn't intimately involved in the Uganda experience, and I know Dan Jones is on this call, and he might have more insight and knowledge on the work there. I think one critical aspect of what led to the change there is that I wouldn't say it was only WaterAid's, I suppose, direct experience that influenced the change. There was one of involving several set of actors and existing relationships that WaterAid had with those actors and the Ministry of Health that was critical, I guess, to catalysing that change, and having technical input and support from those organisations such as WHO and UNICEF, who really lead and have responsibility over monitoring, particularly at a global level. But the actual insider point at which that opportunity became apparent, I don't know, but I do know that it was definitely a coordinated effort among actors that really led to that change in policy and practice at the national level.
Great, thank you, Alison. We have Rathamoni Kith, who is raising his hand. So we're going to unmute you, Moni.
Sure.
Moni, can you hear us? Moni?
Hello?
There you are.
Okay.
Go ahead.
Do you hear me?
Yes.
Okay, cool. Thank you. I see the picture, the sign of the clean drinking water on the right-hand side in front of the lady washing the materials. So first of all, thank you so much for allowing me to have some to share some gap and challenge in Cambodian context. And thanks for Alison for the presentations. I think in Cambodia, as a WASH advocate, I have seen a lot of different things, ranging from the local government up to the national government in terms of water sanitations in both different in different context. One is school, and also one is healthcare facility. I have been involving in WASH and clean water project funded by GE in cooperation with University of Emory University as a manager of program operation for CIS International, and also a former Splash country director that we have implemented clean water program and hygiene educations with the public school. So my point is that here, really interesting topic. I captured three things which are the biggest challenges in Cambodia right now. One is the leadership, as Alison's raised in her presentation. So the local leaderships, I mean the subnational level. In 2018, the national level, the Ministry of Health, they adopt what we call a national guideline for water sanitation and hygiene in healthcare facility. So this is just, it is good. Actually, it is good on the paper, and they just started to have it on the paper, but the implementation remains somewhere that we have to think about on three different factors. One is the local leaderships. I mean the department of the provincial health department. So from the national level, going to the subnational level, the Department of Education, the Department of Health in each province, I think they still like, not if not all, but I observe, because I have met different director of the Department of Health. So I learned that there are some proactive director, and there are some like director that the leadership remains somewhere that need to be built in terms of promoting the WASH in healthcare facility. So training or coachings or some kind of like orientations among those stakeholders, that would be great to do. Without that, meaning that the people under the management, under the supervision, will not be able to uh, uh, implement the policy adopted by the national level. Second thing is the financial capability of the institutions. I'm not sure whether the national level will allocate enough budget by the time that they adopt the national guideline for water sanitation and hygiene in healthcare facility, and I doubt that. So there are two sources of financial solution. One is the allocation budget from the national level, and the second is the allocation of the budget that the healthcare facility that they make from providing the public healthcare service to the local people. So, but this need to be oriented. This need to be uh, given an orientations in a positive way that they can do it. It means they don't need, I mean, the other source of money can be from outside donor, but you know, the local source of money and the national government, that they can provide some budget, that those two parts are crucial to start the work. We cannot wait until we have the outside donor to start the work. And as I said, too many uh, the director of education, youth and sport, and also the director of provincial health department, that we can do it, everyone can do it in terms of
Mona,
drinking water. Yes.
just really quickly, I'm so sorry, in the interest of time, I'm going to ask you to just take 30 more seconds for your comments, and then we need to move on to the next question.
Okay. So those are the gap. Then the last one is MLE, monitoring, learning, and evaluation. That is important to monitor those action that have been in place. So this is my comments in the webinar. Thank you very much for allowing me to speak on this.
Thank you so much, Moni. We appreciate your comments. Just really quickly, a word for those who would like to make a verbal comment. When you raise your hand, please keep your hand raised. If you take it down, then we sometimes miss whether or not you want to speak. But it looks like there was a chat box question from Dan Jones that looks like some of you have already been responding to. And it says, it would be very keen to hear from participants in low-income countries about what they think are the biggest challenges and bottlenecks for WASH and healthcare facilities in their context. If anybody else would like to maybe verbally respond to this or continue in the chat box, we'll just give you a couple of seconds to raise your hand. Okay, we have a new question. Does
Go down to SN Camp.
Kent, would you like to make a comment? We saw that your hand was raised. Kent, can you hear us? Sri Kemp from Nepal Terre des Hommes. Can you hear us? We have unmuted you.
This is Srikanth.
Yes, there you go.
But I'm not from Nepal.
Oh,
I'm from
okay.
India.
From India, forgive us. Please go ahead
I'm
with your
sorry,
question.
was there a question that was asked of me?
We saw that you had raised your hand, so we wanted to know if you had a question.
Oh, I'm so sorry. That must have been by mistake.
Okay, that's fine. We can move on. Thank you.
Thank you.
Does anybody else want to raise their hands or ask a question of Alison before we begin to wrap up? We have time for one question.
Just seen that there's a question from Christine, I think, in the chat box that I've identified. Would you like me to respond to that one?
Please go ahead.
Sure. Just for those of you who haven't seen, Christine's written, could you please elaborate on the trade-off of speed versus support? Donors may be looking for quick wins. How much time does integration in health systems take? Could you give us some examples and talk about the timeframes of these programs? Yeah, it's a really good question, Christine. And I suppose there are two parts of this. Is that one, what donors are requesting in terms of what a win looks like. And I think that's one of the challenges we face, is that while the change that we might see could be rapid, it's not always the kind of change that is strongly recognised as important in donor-focused programs. So when quick wins are seen as improved or an additional amount of, I guess, users accessing a service or infrastructure that's provided, which might be traditionally seen as a win. Some of these approaches, which might be about improving policies and standards, looking at costing and how that can be built into existing financing mechanisms. It could be trialling and testing and contextualizing facility management tools such as WashFit that WHO and UNICEF have put together. So there can be, I guess, what you might see as quick wins. I think there is some lead time in the preparatory work to really understand that, to sort of gain an understanding of what the entry points are and what some of the key priorities are of the health system. And I suppose that could be seen as a quick win in really articulating that, if that's what's seen as a desirable outcome from a funding perspective. So I guess it really means we've got a little bit of work to do to advocate around the types of funding that are provided, and some elements might happen quickly depending on, I guess, the fragility or the strength of a health system as it exists, who else is working on the issue, and some things might be a lot slower burn and require, I guess, more time and flexibility. So being able to influence policy change does take time. If we're looking at things like developing curriculums for pre-service training, so looking at the training of medical providers and improving the WASH and IPC understanding, and I guess input that goes into that curriculum might take a lot longer time. So I guess it really depends, and it also really depends on how we're advocating for donors to design and I guess support funding mechanisms that have that flexibility, that look at what we might consider other types of wins other than just infrastructure or user numbers.
Thank you so much, Alison. In the interest of time, as we're getting near to the 10 o'clock Eastern hour, we're going to be wrapping up the webinar, and I'm just really excited to see that the chats are still going on and people are asking questions and getting some responses from the community. So please keep that up. We'll keep the chat box open for just a few minutes after we close. But for those who do have to leave, we want to make a few short announcements, and I'll pass it over to April.
Yes, thanks everyone for attending, and thank you, Alison, for a great presentation. Just a reminder that we will be launching our WNHCFaction.org website soon, where you'll find all of the recordings and slides for the webinar within the next 2 weeks. Additionally, we're going to share with you a summary document that provides action items, as well as an overview of the session, responses to the chat box questions, and the next webinar is going to be September 19th at 9 a.m. Here we're going to be discussing WASH and healthcare facility assessment tools and monitoring. This is going to be a great follow-up to Alison's important point on the need to move from understanding system context to choosing the right tools for assessments to really take action on making improvements to WASH and healthcare facilities. So please remember, we really want to make sure that these webinars are useful to the community practice in both WASH and health. So if you have recommendations for future topics you'd like to see hosted on this webinar or any other comments or recommendations, please send any of those inquiries or comments to w&hcfaction@emory.edu. And thank you so much for your participation today.
Thank you, everyone. And please feel free to log off at this point, or if you still want to keep chatting for a few minutes, we'll leave it open.